If you or someone you know smoke, they need to hear this. There's a potentially deadly cancer that's seldomly talked about, yet it's the sixth most common cancer among men and women. Along with physicians educating people, a local man tells us about his fight to beat bladder cancer.
So these are your kidneys, and these are the tubes that drain the urine from the kidneys down to the bladder, called the ureters.
According to health experts, this small organ in the pelvis is where thousands of people will develop a hidden threat of cancer this year. Even in their 30s and 40s, men and women, especially smokers, should pay close attention to the signs of bladder cancer.
The most common sign of bladder cancer is blood in the urine. So when patients urinate, they may either have light pink urine, they may have dark urine, they can even pass clots in their urination. And this is a close-up here of the bladder itself, and you can see the urethra, the tube people urinate through, and then this is the lining of the bladder, and then this is the muscle of the bladder here.
Who's most at risk? Men more than women, certain industrial workers, some diabetics, and smokers. You can't say it enough. The greatest risk for bladder cancer comes from smoking.
Just like when it causes lung cancer, there are chemicals that are inhaled and then they're metabolized, and the kidneys filter all your blood, and so basically these chemicals are processed by the kidneys and excreted and then stored in the bladder. So these are the cancers that are growing into the bladder. So you can see here, these are the more superficial ones that are staying in the lining of the bladder, and then these more aggressive cancers that are getting down into the muscle and even outside the bladder.
For me, it had been hiding for, who knows, several years. I had no idea that it was growing there in my bladder.
A diagnosis of advanced bladder cancer shocked Davis Campbell, a non-smoker at 42 years old.
I didn't hurt. I felt fine.
3/4 of all bladder cancers are superficial, and so they're in the lining of the bladder, and just by resecting it, which is done in the operating room, you can treat their cancers. Some cancers are deeper and are into the wall or the muscle of the bladder, and those require a more involved surgery at a later time.
Initially, Campbell's stage 3 bladder cancer had grown through the lining into the muscle outside the bladder.
About a year and a half later, the cancer was rediscovered in my lymph nodes, and I had to undergo chemotherapy for 3.5 months.
Campbell also faced major surgery, blood transfusions, and long-term fatigue. He was hospitalized 5 times.
I developed some side effects from the chemotherapy, like peripheral neuropathy or numbness in my feet. My kidneys were damaged, and as I mentioned to you, I lost part of my hearing.
Later, Davis's doctor told him he had only a 15 to 20% chance of living 5 years. The 7-year survivor lives an active life with an artificial bladder. 52-year-old Campbell now fights cancer by educating and encouraging others through his book about faithfully beating bladder cancer.
Never give up. Continue to do the normal activities of life. If you do the routine things of life, it tells your body that you want to live.
I want to point out that experts say that the diabetes medication Actos increases the risk of bladder cancer. Now, Davis Campbell is a nurse practitioner as well as an author of this book, A Place I Didn't Want to Go, My Victory Over Cancer. Learn more at his blog. That's cancerovercomer.blogspot.com. And urology centers of Alabama stress if caught early, there's a greater chance of beating bladder cancer. It's estimated there will be 960 new bladder cancer cases in our state this year, 140,000 in the U.S., and an estimated 10,000 Americans will die because of bladder cancer.